I'm Dr. Shreyas from DailyRounds Marrow, and I would like to welcome you all to our podcast, Path to Public Health Stories and Lessons. This podcast is focused on exploring the dynamic field of public health, its core principles, the challenges involved, and the rewards and opportunities for doctors. To guide us through this, we have with us Dr. Parag Bhamre. Dr. Parag is a medical graduate turned public health professional specializing in health policy, economics, and finance. He has an experience of over 14 years, and his work spans from grassroots level organizations like the Jan Swasthya Sahyog to international organizations like the WHO, Vadwani AI, and Jhpiego. He has worked extensively on women's health, particularly women's cancers, and he has been instrumental in implementing evidence-based strategies for early diagnosis, care, and the decentralization of diagnostic and treatment services. He currently serves as the Global Technical Lead for Women's Cancer at Jhpiego. Thank you for joining us, Dr. Parag.
Thank you so much, Shreyas. Thank you so much.
So before we begin, I would like all the participants to know that we'll have a live Q&A session at the end before we wrap up. And we've also collected all your questions that were put up during registration. So we'll be taking those up as a part of the discussion as well. So before we begin, Dr. Parag, you are an MBBS graduate yourself. And so most MBBS graduates usually have an inclination to join clinical medicine, to be practicing doctors, seeing patients, treating them. So could you tell us why, you took up public health, as in what prompted this transition into public health from being a doctor?
Thank you so much, Shreyas, for this opportunity to share some of my learnings with fellow colleagues. And this is a usual question that comes to me. And in fact, sometimes even I question myself, like, what is that trigger point? What made me think in a different way rather than practicing the way most of my colleagues or friends are doing. So, I studied in Topiola National Medical College, Mumbai. During my MBBS, and most of the Mumbai-based medical students know that the usual trips that happen in and around Mumbai are in Ghats of Sahyadri. And this photo that you see here is actually, somewhat similar to what we saw during our one such trip in the areas near Matheran. If some of the attendees know about it, it's a hill station near Mumbai, just 2 hours away from Mumbai. But in the periphery of that hill station, the situation even today is something like what is visible right now in the photograph. So this is sadly called as Bambulance, in which a pregnant lady is being carried to the referral facility from the foothills of Sahyadri. And this situation, though, and this is exactly the situation that I saw around where I was working with one small NGO in second MBBS. And when we were going on the field with them, this used to be the usual picture. I'm not very happy to share that even today in areas of Nandurbar, Khargone, the Satpura Hills or Sahyadri Hills, you do see similar pictures. And for me, actually, that really was a hard hitting fact. And that association with the particular NGO, really helped me to actually get into the depth of the realities of the field. And I just changed my course. I didn't appear for any competitive exams as our other fellow colleagues were doing at that time. And I chose to go for applied public health in a way. So that's the main trigger, Shreyas. And later on, many mentors who I got to have interactions with from community medicine, from public health field, actually helped me to, take some right decisions. Which probably some of those lessons probably I'll try to share today with you. Thanks.
Yes, sir. Sir, so apart from this, were there any other major turning points in your journey that has, brought you to where you are right now?
Yeah. So like I said, along with such triggers, what really helps is who you are working with, right? So when I was really interested in exploring this field further, the exposure at Janaswasthya Sahayog, a Chhattisgarh-based organization, really helped me, and that actually supported all my key decisions that I took along the pathway. Janaswasthya Sahayog works in the tiger reserves in Chhattisgarh, in northern Chhattisgarh. And when I finished my MBBS and went there, I was not at all aware even of the basics that are required at the rural setups. Unfortunately, let's say I'll give you an example of snake bites. One of the projects that I was working there was on snake bites. In Mumbai medical colleges, you will see snake bites, but all those, cases would be either absolutely progressed. They were not the ones who you have exposure to manage at the primary healthcare level, right? And that's what the major realization that came to my mind. That was a hard hitting one for me, that you are trained at one of the, so-called best medical colleges, but still the requirements of the field probably are not being catered by that expertise that you have, right? So those realizations and then mentorship that I received at Janaswasthya Sahayog is something that, helped me to be on this public health path, I would say.
Yes. So, could you also tell us more about your experience with the international organizations you worked with so far? WHO, Wadhwani AI, and Jhpiego. I think you were previously in Jhpiego, and then you shifted over to Wadhwani AI, and then you have come back to Jhpiego right now. So, could you please tell us a bit about how that transitioned along?
Yeah. So after few years at Janaswasthya Sahayog, I went on to join World Health Organization. That essentially in their routine immunization and measles surveillance and polio surveillance program at Bihar. So I served at Madhubani and Darbhanga districts of Bihar. Now, those who are aware about this national polio surveillance program or routine immunization surveillance program of WHO know that it's something which really, it's completely a framework based program, right? And incidentally, all that exposure was there during the times when India achieved the polio eradication. It was around 2011 to 2013. So most of the principles that were implemented for polio eradication were getting re-articulated or getting repurposed for immunization or measles surveillance related work or Kala Azar surveillance work, So that sort of a transition and that sort of a consolidation of all the polio related learnings and the way it was happening for immunization really helped me in Bihar. After a couple of years at WHO with that surveillance team, I came back to Jhpiego and was serving in Maharashtra as the state program officer. The program that I was working on was on maternal newborn health, and that again, linked it to my first trigger that pushed me in public health. So we got to work with public health hospitals. Essentially, the program was on quality of care in maternal newborn health, which later on was also replicated for private sector within the state, because as you know, Maharashtra is a pretty urbanized place. So this entire execution for public and private sectors on quality of care was something that we were working closely with government. And then around after 5 years, I decided to try the upcoming field of, AI or artificial intelligence and joined this startup called as Wadhwani AI, which is actually trying to find solutions for existing social issues across health, education, agriculture, and trying to see whether AI can add value there. So, so I got to work with them, and after again few years there, I came back to Jhpiego, and this time working at the national level to work on maternal newborn health and eventually cancers as well. And within cancers also women's cancers, essentially because what Jhpiego is an organization which is a Johns Hopkins University affiliated organization. The full form of Jhpiego, which we used to use like around, when it started, is Johns Hopkins Program for International Education in Gynecology and Obstetrics. So it was started with the Gynae Obs Department of Johns Hopkins as an effort to bring latest evidences in Asia and Africa or lower and middle income countries. So women's health remains the core area of work at our organization. And I currently work at national level and also beyond India to see possible pathways to strengthen cancer programming in lower and middle income countries.
Thank you so much for your insight, sir. I wanted to ask, what do you love most about your job or, public health in general?
I, I I love the energy that I get out of different interactions that usually happen with multiple people. It's never the same day. It's never the same thing that you have to do. It's that dynamism or that energy that I get, every other day with every new challenge, if I can say, is something that really helps me to be helps me to be, ready for the challenge of to tackle that challenge.
Yes, sir. Like you said about, the diversity of challenges, problems, and opportunities in public health. Public health also means different things to a lot of different people. One of my colleagues had even remarked that public health is everything under the sun, around the sun, and the sun itself. So, depending on your perspectives and your experiences, how would you define public health, sir?
So, Shreyas, I think it's, it's not really a very complex science as well, but I do believe it's art and science both. It's more for balancing public or balancing the human relationships or balancing people in a way, and then also bring out the science that will really make sense to those public. It's more for public than the mystified scientific approaches that we usually talk about. So the way I have realized it's more of art than science, but it's also a skill by which you demystify all the complexities around this scientific knowledge that medical community has, right? So how do we bring that in a more demystified, simplified manner to public at large is something that I think that intersection is public health. So it's not like one particular domain, but it's actually the intersection.
Yes, sir. And sir, could you please, shed more light on the domains of public health? As medical students, as doctors, we are usually only aware or exposed to the healthcare, the patient-doctor relationship, or the hospital side of the things. So, could you tell us more about the other domains that make up, at least the main ones that make up public health?
Yeah, so these days, in fact, it is a very, very fast evolving field, and at least in my journey, what I have seen, these intersections are now now getting into newer and newer areas, right? Like let's take an example of technology. So these days, if technology and value of technology is to be brought to the field of medicine, I think public health can actually make that happen, because when you talk about data science, it's all about masses, it's all about numbers, it's all about basic medical statistics or biostatistics applied in an advanced manner. So I do believe there are multiple new dimensions that are opening up for the field of public health. When we started probably around, let's say, 2 decades ago, people who have started in community medicine few decades ago used to consider this field only as a field which is around sanitation, wash, or activities around immunization. But if you see now, it is more around use of tech for wider public health decisions, use of vaccinations for emerging illnesses, talking about areas such as One Health, wherein you talk about animal health plus human health. Now, so all these new dimensions are actually opening up for public health. There is also a major dimension around financing, because if, let's say, COVID-19, and many of our colleagues or many of our, in fact, general population also got exposure to the field of public health just around pandemic, right? Just because of pandemic. In fact, I also want to mention that quite a few people in urban areas very first time realized that the vaccination site is just next to their colony, which has always been there, but they accessed that particular site just because there was a COVID vaccine that was available, right? So all those, population level dimensions are opening up in today's public health. It is no more only the sanitation or wash or hygiene or immunization related field.
Yes, sir. And like we said, the public health is, multidisciplinary, has lots of domains involved. So, but apart from this, is what are the other differences between public health and, conventional medicine? And, usually we do talk of public health and clinical medicine as distinct entities, but they also have a complementary role, the one other, and are not so distinct to each other. So, could you please tell us more about that, sir?
Yeah, in fact, I can use one short case study, which will talk about this in more details. So, to answer your question, I'd like to show one real example that we recently, implemented in the state of Madhya Pradesh. And I'll again take example from the maternity event, so, and I'll relate it to how you mentioned about the role of clinicians and role of public health people, right? So, whenever a woman gets pregnant at a village level, she visits the nearest antenatal care clinic, and at that clinic, usually nurses are there, right? And these nurses take their history examination, basic investigations. And unfortunately, if this woman has some of the, risk factors, or if any of the examination investigation comes in an odd manner, she's classified as a high risk woman, right? And then she's sent to a nearest medical officer. I think this is the first point. And for 70 or 80% of our women in the country, this is the situation, right?
Yes.
And I'm not right now talking about urban public health, right? And that is also a challenge in a way, right? But if I give you an example from rural side, then this doctor decides that woman needs additional investigations and, either decides to send her back to her basic clinic or ask her to undergo subsequent investigations, right? And these decisions, get more and more complex, let's say for the events such as maternity, because it's a 9-month journey, right? And many places, many times, woman decides that she wants to shift, she wants to go to her mother's place, she wants to go to, other village based on their family situations, right? And incidentally, when she decides or when she is due for childbirth, if she is in some other village, unfortunately, many times, woman will have to, go through, and if she is high risk, she might have to go through primary health center, then the nearest district hospitals or nearest private hospitals, may have to consult charitable hospital. And all these complexities are actually happening with quite a few number of cases in our country, right? And here, having a look at this complete picture and these moving and dynamic situations, right from the community, the family, the different setups that are involved, the walls that are there between community and facility, there has to be, someone who is looking at all of this. And I think that someone is a public health professional or a public health physician, and not only this, but the data that comes out of all of this, now this is, I'm showing some data points based on the latest portals, not mentioning state for the reason, but there has to be someone who is looking at not only these patient journeys, the social science behind all these journeys, but also the numbers that are coming out of our, out of different databases. And then the results that is coming, the impact that is coming, the highest number of low birth weight prevalence that is there in few pockets, the maternal mortality that is there in few pockets. So I believe clinician's role is essentially at this level, where we are finding the high risk client and then managing that client. Or sending that client for subsequent workup. The public health professional's role is multidisciplinary, multidimensional, and it's kind of a zoom out view of the entire situation. But I also want to mention here, and one of my mentors used to say this, it is not only about zooming out and a 30,000 feet view, it is also about, it is something called as dolphining, in which you like dolphins, when they are at the surface, they take jump, look at things from above, but also take deep down, also take a deep dive to actually see what is the root cause, right? So that sort of a work is required from the public health people. If I, and just want to add one more dimension to it, when we basically saw this sort of a fragmented pathway in one of the states where we are working, the solution that we try to, come up with is is using data for decision making, using and establishing digital continuum for all the mothers in that particular state, right? And I like to show this case from this place where, this sort of a continuum has been established. And not only continuum, but, there are certain higher, smarter devices that have been deployed in this particular state, which is visible in this particular slide, Now, if you see, these are all auxiliary nurse midwives, who are anyway at the village level. What we have tried to do is to provide these devices, not only, simple ones, but devices which were Bluetooth enabled, because these days, as you know, simple technologies can actually, if made available, can change the way care is being served, the care is being given. And that's what we have tried to do in this particular, this particular state and this particular intervention. Now, what I'm trying to tell you is, identifying the social issues, the complexities around client's journey or patient's journey to the introduction of technology, and then subsequently also using data that is coming out of this use of technology, right? Now, if I tell you, when we introduced this particular technology back in 23, the initial adoption was very, very challenging, but eventually as ANMs were, as their feedback was incorporated, as they were trained, as they were given adequate, hand-holding, the overall adoption, after August increased to beyond 80%, and this is all the use of those devices in the communities. Now, this is also public, right? It is not that, and then how smart and how, well acceptable devices you're bringing in this entire scenario is your creativity, right?
Yes.
And this obviously improves the quality of the data. Now this is the chart regarding hipping of the data that is visible that is usually visible in our records, right? I am sure some of you who are clinicians and have visited facilities have seen consistent recordings of blood pressure of 120/80, or 110/70, or birth weights of baby as 2.5 or 3 kg. Now that is called as hipping of data, right? There is a natural human tendency of reporting around average values. But if we introduce devices like these, we actually see reduction in that hipping of data. And more interestingly, we can also use that insight or use those devices to identify women with actual high-risk conditions. Now, I'll take your attention to, let's say, weight. When weight-related device was introduced, or this Bluetooth-enabled weighing machine was introduced, the weight-related high-risk detection increased by 7%. Now, these are those women who otherwise would have been missed, right? And I think that sort of a job is there for any public health professional. And this is just one example. And I want to, gladly share that when we presented this to Government of India, they took it very positively. And there is a national letter or national DO order that has been released to ensure that devices and such bags are available for every frontline worker in the country, so that such decisions can take place in time. Yes.
Thank you so much for sharing that. So this was one example of public health improving the clinical pathway, or clinical care, or the healthcare from an implementation perspective. But public health can also play a complementary role to clinical medicine in terms of advocacy, policy, and research as well, right, sir? So could you give us some examples or some real life scenarios where this has come into action?
Yeah. So one example, let's say, that comes to my mind is introduction of latest evidences. Now many times clinicians want to see that most updated medicines are available in the clinic, right? But because either it is not approved by regulatory authorities, or it is not included in the essential drug list, or it is not procured by the procurement channels of the respective authorities, or state or central, or maybe even respective hospital, right? So at that particular with this particular situation, I think public health professionals can actually help to solve this complex issue. And I'll give an example of, let's say, there is a medicine called as heat stable carbetocin, right? Now, many of you might have heard about oxytocin, which is given to every, after every childbirth, right? And there are 28 million childbirths that are happening in the country, right? And we know that oxytocin needs cold storage, right? So one assignment that we are trying to, take on today is, instead of oxytocin, which is requiring cold storage in our country, and situation with cold storage, situation with electricity is something that doesn't need any discussion here, but we all are very familiar with those problems. So can we have a solution? Can we have a medicine which is already used in private sector and which is already a top selling medicine in private sector for the same reason, for the same cause? Can we offer that for, can we make that a norm, right? So, how do we introduce these right medicines in our entire public procurement channel or how do we make it as a norm, right? Wherever it is happening, ensure that this medicine is given so that clinicians have, right tools at their perusal. It's not always at the mercy of the situation and then hopes that, and with the hope that everything will turn out in a right manner, right? So I think that sort of a role public health physicians or professionals do play, that identify those right interventions and then do advocacy at right levels and introduce those innovations for everyone who is practicing. Yeah.
Thank you, sir. I would like to build up on, the challenges you just spoke about, the regulatory ones, the challenges, the bureaucracy, the lack of resources in terms of cold chain and all that. So what are the common on ground, challenges a public health professional can expect to face?
Yeah. So, the most important ones are around public only, right? Like it's all about what sort of interpersonal dynamics is playing out in the areas where you're trying to intervene. So it's mostly around that, and that's why when we think about public health approaches, there are three essential skills with which we have to manage those complex situations, right? And like I said, if it's about public, then there has to be a political sense or political quotient that every public health professional need to have, because if you're trying to introduce something or if you're trying to push through something or advocate for something, the first reaction or first resistance that is going to come is through the peers probably, or is through the officials, or is through the people who are holding the power in that particular situation, right? So that is one challenge, if I can say. Second is again the mystified nature of most of the scientific knowledge, right? While the people may assume that public health professionals basically need to have understanding about, let's say, immunization chart, but it's not so, I believe. You have to have that technical soundness. You have to have that technical excellence so that you can demystify stuff and then present it in a manner that is acceptable to clinician as well as a particular politician or maybe a bureaucrat, so that demystification is something that is again an essential thing. And there I will say that, the complex nature of presenting a particular scientific topic itself is a challenge, like how public health professionals learn about it in a right amount and then demystify it to a level that it can be disseminated in an adequate manner. The third one comes is operational issues, right? So there are many times ideas are good on paper, but they don't really get executed, right? And for that, some sort of operational rigor is required with every public health professional. For that also, then, identifying the right operational challenges, identifying right avenues to solve those challenges is something that is the duty of the professional, I believe.
Yes, sir. So, even if a doctor is not strictly a a public health professional, they still face some of the challenges you've just mentioned. So what could be the skills, or the competencies one can develop to navigate around these challenges?
Yeah. So, I'll probably again, repeat, and this is again something that the kind of a formula that they say every person should have in a way who is practicing in this field, and it's like a top skills. These are like TOP skills. So the first one is ensure that you have T is for, like, let's say, technical excellence. What field you are in and what exactly you are trying to solve, right? So let's not discount that. Let's not discount that technical excellence. That is first T, I would say. The second O is about all rigor that we should have. The ability to get things done. That operational rigor is very, very important. So, and the third one is that political savviness, right? That political quotient. So the major skill set that anybody who's thinking of public health should have are these three, essentially, like top ones, right? The technical excellence in areas that you chose to work in, the operational rigor, the hunger to get things done, and then that political savviness, so that we don't get entangled into the resistance that is there in the ecosystem, right? So, yes.
So now that we have gotten the challenges or the on-ground realities that most public health professionals face out of the way, so could you tell us more about your most exciting and the most rewarding experience in public health in your journey so far?
Yeah. So for me, couple of things really, really stand out. One is around this work in Maharashtra, which we did on quality of care for maternal health or maternity homes. And I am very glad to share that, Maharashtra is the only state where there is a single program to certify quality of maternity homes across both public and private sector. And it's a government recognized initiative. And I had an opportunity to work on that initiative right when it was even in the paper, then getting executed in few facilities of couple of districts. And then, then seeing that it is getting launched by the Health Minister of Maharashtra. And that particular initiative still runs in the state. And I do believe that is one of the most important and rewarding experience that I had. The second one, like I just mentioned, the bag that I showed to you from one of the states, it started with few ANMs, few auxiliary nurse midwives, and it became like a national mandate now. It's still not there on the ground. Like I said, converting those guidelines into action is also a job that public health professionals have. But I do believe that at least getting those mandates from national government is something that is a powerful one, and that really helps. That really is something that that I consider as a reward.
Yes, sir. So just to build up on what you just said, sir, like there's usually a big gap even between theory and practice in public health. So how can that be bridged, for somebody who's aspiring to be a public health professional in terms of the theory or the knowledge in books and the skills they should have?
Yeah, so I do believe, the field exposure is very important. Whoever is willing to go for it, I think please choose right courses, because these days there are many MPH, MHA, even MD, community medicine, and various options that are available, PGDMs or family medicine related courses are also available. So please choose right courses, and please choose course which gives you adequate field exposure, because just classroom coaching or distant coaching is not really going to give right skill sets that are required. Because what we are seeing, and I must mention it here, because many medical professionals who are thinking of it possibly are here. Taking degree is one thing, but now when we are trying to hire few people or few officials on some of our roles, what we have realized that students do have degrees, or candidates do have degrees, but employability is a big problem. So just having those degrees is one thing, but please decide institutions where you get those degrees with adequate skill sets also, and those skill sets will come in only if there is adequate field exposure. So my request would be to think twice about choosing right places and focus on field exposure in early part of your career, because like I had mentioned earlier, it's more for public. You have to have as many interactions with diverse audience as possible if you are aspiring public health professional.
Yes, now that you mentioned the various courses MPH, MHA, and MD Community Medicine, one of our attendees had put up a question asking like, if I had to choose between an MPH or an MD Community Medicine, especially given the opportunities they open up in India as well as abroad, how should I go about choosing it? That was one of the questions, sir. Could you please tell us about your opinion?
Yeah. So see, obviously, MD Community Medicine is a course which is like a 3-year course. Is has some of the very wonderful institutions offering that particular course. But my personal opinion is it has less of a applied public health component, right? So it's more for someone who is interested in advanced, let's say in academics, or someone who is interested in practicing within the medical institutions, or someone who is interested in running or taking research projects, but courses like MPH, why they first of all came, even when we had MD for such a long time, the very reason is that they have some applied component, right? And there are certain subspecialties that they have, that some of the institutions have introduced, such as social epidemiology, such as health economics and finance and policy. So if you are keen on pursuing some super speciality, on the applied side of things, then you may think about MPH courses with that particular substream, right? MD Community Medicine is more overarching, with little bit of additional academic stint, or is what my opinion is, and I believe, based on the preferences that a candidate has, they can choose a field which is more on the application side, or field which is more on the on the basic principles and academic side of things of the public health. And another dimension is around use of these innovative, or the recent advances that are coming in the field, right? So I think like use of AI, use of data science, use of advanced biostatistics is more recently seen in MPH courses. I'm yet to see it. I've yet to learn about it, that these courses have been incorporated in the community medicine or MD courses as a requirement. So with changing times, it's important that we choose those right courses and pursue our interests, in either of these options.
Yes, sir. Thank you, sir. So, sir, like you said, there's no substitute for field, experience or exposure. But suppose somebody has no access to, formal training like a MD Community Medicine or an MPH, or they do not want to pursue that because they already have an MD in some other discipline. Are there any other online resources or alternatives you would recommend they can use to brush up their skills or improve their expertise?
So there are quite a few. In fact, the sites that are available through national government, I think are very good resources to start with. Then you have many knowledge action portals from WHO's and affiliates of UN. I think they do offer courses which are freely available and very nicely compiled or curated. So I think one site to go, or one site to recommend is a tough thing to do right now, but starting with national government portals, and then the communities that are there with these UN organizations. It's important if students who are willing to go for these resources, if they can join this community of practices, based on their areas of interest. They do provide adequate resource library or repositories.
Yes, sir. And sir, like we all know, public health is, the public facing or the population level work. And, this can be overwhelming at times. Burnout is a common phenomenon. And because your work, you cannot see the results of your work very quickly, it often becomes difficult to maintain your sense of purpose as well. So, do you have any advice for people, potentially into public health on to how to manage these, how to manage burnout and, maintain your sense of purpose?
Yeah. So on that, I would say it's important to have, consistent dialogue with your peers, because, as they say that, when in trouble or when you're facing such situations, it's important to speak out. And I think efforts from your group, is also really highly appreciable, because you're allowing that sort of a dialogue, maybe in a virtual manner, but, that also links people together. So it's important to keep discussing, keep talking, and express ourselves, at least amongst peers. If we, if there are moments of dullness, or there are moments of, and these burnouts and all are, are part of the game, I believe. If there is passion, if there is drive, if you see, if you always remember those triggers that actually made you take those decisions, I think it's helpful. And that's why, even, and also right mentors, choosing and having mentors is very important in our field. For me personally, I really, really value the advices and guidance that I have been able to get through various mentors. So
Yes.
I think, yeah, that's crucial.
So basically, finding the right support group and the right mentors is what is going to help us keep moving ahead. Yes, sir. So, sir, like among MBBS graduates or doctors, there are maybe three main set of people. MBBS graduates looking to get into public health, MD community medicine graduates who are going to work into public health after finishing the residency, and even people who have done their MD, MS in some other specialty, but you want to work with public health or in public health. So, sir, could you please tell us more about the pathways for all these three groups? Like what are the opportunities that open up once a person follows a particular path among these three?
Yeah. So, usually the first path, I would say, one can always go into academics. There are, like I said, there are many universities offering courses. So academics is one path. If you are MD community medicine, I think that is a direct path that is available. If you are MPH or any other stream or any other specialty, any other course that you have pursued parallel to MPH, then there are courses which allow you to get into the lecturership or academics. Apart from that, the jobs in government sector are also there, but I must mention that they are not adequately, or relatively underpaid. The field unfortunately doesn't get recognition or doesn't get remuneration to the levels that it, or to the level that it deserves, I must say. Because why NGOs or international NGOs exist? Because you need this talent within government channels or systems to manage all of this complex programming, right? But because unfortunately, that sort of attraction or that sort of a push is not there for the field. That second avenue is little bit challenging at this point in time, but there are options, there are possibilities, there are opportunities for sure. With the negative element around remuneration, there is something positive, which is job security that comes within the government programming, and so there are those options available. The third one is more into NGO sector. There are very good national NGOs or international NGOs. Like I would say, our organization also has reasonable presence in the country and beyond country. There are other similar organizations which do offer pretty much similar opportunities to public health professionals. And also the benefit with national or international NGOs is you get to work at those intersections, or you get to work at those frontiers, which are actually taking fields forward. And these days, even governments have accepted the, crucial role that these organizations play. So most of what I presented is actually very, very closely done in collaboration with governments, right? So there you get benefit of being at the frontier, but also contributing into the national programs, right? So those opportunities also open up. The next one I would say is also these consultancy firms, So these days, many public sector enterprises are actually supported by consultancy firms, right? And these consultancy firms do require public health professionals. And when I say consultancy firms, these are like big fours, as they call it, right? So even opportunities are opening or available in these firms. So, so right from academics to consultancy organizations, there are various avenues. And I must also mention possible opportunities similar to consultancy firm, but more so in tech side of things, right? Because with the traction that data science and AI related things are getting, those organizations are also now setting up, right? So that is also a new stream that is coming.
So about these international organizations, these NGOs, what are the particular skill set they look for, apart from the top framework you just mentioned?
Yeah. So, let's say if I give example from our own team, the way we hire is obviously, that employability angle that I mentioned, because designations or credentials is one thing, but ability to be a team player, ability to really be in a position to represent organization in front of stakeholders, which are of critical importance, right? Because here it could be a secretary level person, or it could be, it could be even the senior UN official, right? So, and at the same time, it could be also an auxiliary nurse midwife, right? So a person has to be dynamic enough to have abilities to connect right from secretary to those auxiliary nurse midwives, right? So what we try to do, because like I said, like dolphining example, right? So we want someone who has that health system lens, but also has ability to go down to the client's issues, like individual level issues or family level issues, right? So that sort of a I think that sort of a personality is crucial. Also, use of these, latest solutions, latest technologies, or even use of gadgets is also these days getting a lot of importance. Ability to present data in a particular manner, ability to demystify scientific content in a particular manner, these skill sets are essential ones if anybody is aspiring for national, international views.
So you mentioned, AI, finance, health economics as some of the emerging domains or niche domains that, can help somebody set themselves apart. They, are wanting to start out as a public health professional. Are there any other domains that are emerging, sir? Newly emerging?
So one thing which is really, and I personally am also interested, I'm possibly, exploring that field in these days, and I can really sharing that is around is design research, or design thinking. So, many of us know that we use WhatsApp or Instagram or any other application smoothly without requirement of any training on it, right? Why so? Because those who have developed it have really studied user mindset in that manner, right? So there is a proper science, like why this color, why button should be here or there, why one screen after the other screen should look like this, right? So when we are going towards more tech savvy world, I think one skill set that anybody who is thinking of, thinking at public health level should have possibly, or, it's better if that person has that skill, is that design thinking, like, like, uh, and I personally am interested in at the intersection of technology and clinical health or public health. So for me, I think that is one field that's really getting a lot of traction. And I must tell that there are NGOs that people have established around design thinking, like UI UX research, as they call it, user interface and user, experience related research, and then subsequent design thinking to inform the products that are getting formed in the sector. And these products may not be always technology products, right? Sometimes they are even simple job aids or simple charts that are prepared. Why applications that are prepared in, in government programs, let's say, do not see that sort of an adoption, because the design thinking principles were not deployed there. But on the contrary, there are many private sector applications which are, even for simple orders, get so much of attraction. So that science of design thinking is something I believe is really coming up. So along with Excel fine tuning, that is one field. Obviously, this AI is not just one, even an acronym, but there are quite a few different dimensions within it. So that is also something that needs a larger and better study.
So, could you just tell us about a couple of these dimensions that, clinicians or, doctors can work
on AI side of things? So, yeah. So let's say if I, so as they call it, there are essentially three major ways, in which I'm just again simplifying it a bit, or maybe oversimplifying it, but essentially it is, those computer vision solutions, right? In which, let's say an X-ray is available, you take the shot and AI helps you to read that X-ray.
Yes.
So how doctors can help in actually tagging lesions in the X-ray films so that AI can be trained in a right manner, right? So it could be X-ray, it could be tomorrow mammograms, it could be an oral lesion image, but it could be even images of your retina, just to inform that AI. So, one important work that is coming to probably medical, practitioners who are in such fields where images are important is annotation, right? Like is marking those lesions in a right manner and interpreting those images so that technology is well trained. The second one that they usually call is around data science, right? Like the example that I showed, right? How population level data is looking, what are the heat maps, what is the prevalence, incidence, why one particular risk factor is important over the other, and helping technology use those analytics, or those biostatistic insights for training, I think is one dimension. The third one could be language, right? Related to that natural language processing, right? Because if I'm asking you one question, what response that chatbot, let's say if you're deploying that chatbot should give, right? Because we are moving to a time where probably I don't have to, ask anybody anything. I just have to type it and I'll get the answer, right? But if it is related to medicine, if it is related to health, what those answers should be. So I think it depends which use case you are trying to solve, or which use case you are trying to work in, and then the role of medical practitioner will be accordingly to that particular use case.
Yes. Thank you for sharing that, sir. And sir, there are a lot of myths and misconceptions around public health. Would you like to debunk any of those, like some of the myths you commonly hear?
The first thing, it's the biggest one is it's boring. So I don't think it's at all boring. It's so exciting. Like I said at the start of our interaction, it's every day is a new challenge. It's a very, very fast moving field. Obviously it had those preconceived notions around it. But I personally feel, and I strongly feel that nothing can be more exciting than this if you really want to go out and explore. It's in the field which really helps you to explore as at its best.
And sir, does choosing public health mean that you're no longer a doctor?
I don't think so. I don't think so. Like I said, this top thing, the first in that top is T, technical, excellence or excellence in the topic that you have chosen, right? Like I work in cancer. Now I'm not at all an oncologist. And whenever I'm talking to an oncologist, first thing that I tell them, I'm not at all oncologist, right? So I know where my boundaries are, but I can definitely help you to get patient detected early with the lesion. Now that is what my job is, right? Like how do I ensure that woman who has lump in her breast moves from her house to the nearest center and get herself diagnosed? That is my expertise. Now what to do with that lump is doctor's expertise, right? But I think to give due attention to that particular lump, or to give due attention to establishing diagnostic setup nearest to her houses is my duty. And for that, I need that medical knowledge, right? I need that medical knowledge in its right forms, in its right shape. I don't need to be an oncologist for it, right? So I don't think it takes you away from doctor, but it's doctor for the community, essentially.
So, and you did say that, the pay or the salaries are a bit limited on the government side of things, but are there lucrative opportunities as well, sir?
Yeah, so there are, again, depends. Like the later ones that I told, and I'm sure eventually even in government programs, we will have better and more opportunities because, COVID actually saw the impact of public health, right? So, and these days we do see that government is setting up, that sort of a structure. If you have heard about National Health Authority, it came up as a one of the most important authority these days, which is managing most of the insurances in the country. Its time is anyway going to go way better and better. But even later avenues such as such as international NGOs or consultancy firms, they do pay equivalent amounts as you see for other specialities in our cities, right? So obviously the opportunities are not right, are not comparable to the fields where you usually practice, but there are certain opportunities. If you have right skill sets, I think it's just a matter of time to get at right places.
Yes, sir. Thank you for those wonderful insights. Now we'll be taking questions from our audience. So I request the attendees, if you have any questions, to please type in the chat box. Okay, so sir, we already have one from Dr. Samiul. He said, "Good evening. I want to take up MD, Preventive and Social Medicine. Can we work in public health programs? Also, could you please elaborate on the career aspects of MD PSM?" Okay, sir, that has already been covered.
Yeah, I think we answered.
Yes. Let's just let's see. Sir, actually, there was another question that we had received. Is age a factor to join public health organizations like the UN, WHO, Red Cross?
So no, not that I know of, because recently I came across a person who is working in humanitarian space. She started her public health career, at the age of 52. After completing all her, after completing, after being a medical practitioner for quite some time. Even in our teams, we have people who were practicing doctors for 20 years, 25 years, but later on decided to join public health because of interest or, decision to shift careers, right? So I don't think age is a barrier, and more so for UN organizations. Most of these senior level positions like P4, P5 as they categorize it, actually consider clinical experience as an important parameter, because they're at that level, that sort of an experience in the field is important and, crucial to serve in that role. So not that I know, it is not the barrier at that.
Sir, another question is how to get into national health programs. Dr. Abhishek, can you please tell us, like, are you an MBBS graduate, or are you asking after, you know, you want to get into national health programs after your MD?
Maybe Dr. Abhishek is on mute.
Huh? Yes, yes. So maybe we can discuss both, or maybe after your MD or even after your MBBS.
Yeah, so opportunities are more after MD to get into the national programs, and like I said, there are two, three major ways. One is through a contractual post that get advertised, and that usually happens at national level. The second avenue is to join the service through the national competitive exams that are there specifically for public health cadre. There are UPHC exams as well. So if one is interested, they can go for those and then enter the system through that. The third avenue to work with national health program from as an external support partner is through NGOs or national NGOs, where, like I said, myself, I work with national health program, but not on the payroll of national health government. It is more from the supportive organization.
Yes. Thank you. Thank you. Sir, we also had one more question from Dr. Sachin. What does the future of community medicine look like 5 years and 10 years from now?
Yeah. So, like I said, it is promising. If and I want to have double if or even triple ifs here, because one very important element that must happen within existing community medicine, curriculum is incorporation of these newer frontiers, right? Incorporation of these newer topics or subtopics, because unfortunately, that curriculum upgradation is much slower than how field is moving fast. In comparison to how field is moving, but if that sort of if that sort of a thing happens, or if candidates who are pursuing MD community medicine also parallelly or subsequently go for these courses, to be upbeat with the pace of the field, I think there is a huge promise. So be very optimistic. I'm personally very optimistic about it.
Yes, sir. So now we have a very interesting question, sir. The question is, how do you address misinformation or distrust in public health initiatives?
No, it's an important one and critical one. So here, I don't want to give theoretical answers. There are theoretical answers like, do this, that, but I think the examples around vaccine hesitancy is a great example that how do you address mistrust, because that has happened earlier for vaccines like polio, later for vaccines like even COVID, right? And what we have seen really works is influencers, right? And how do we really onboard right influencers? It could be even the pandits or Maulvis of the community, or it could be even social media influencers, right? Because in public health, that perception really matters, right? And this mistrust can be broken if you have these champions of the community with you. So how do we identify those champions and then really, utilize their presence, expertise to break the myths, break the mistrust is crucial. Yeah.
Thank you, sir. The next question is, how does one look for public health opportunities in India and abroad after doing an MD in community medicine? So, sir, I think that they're basically trying to ask what are the channels they need to look into.
Yeah. So I don't know if colleagues here have seen websites like DevNet Jobs India. So there are quite a few others. I'm not proponent of DevNet Jobs, but I'm just sharing that because it's something that really gives good collation of all the available opportunities. Obviously, other social media platforms like LinkedIn are there. So my submission is is to have a look at those portals, at least for the variety of jobs that are there in the sector. And then subsequently, Also, subscribing to couple of good organizations live portal. Like if you have your goalpost decided, let's say one wants to join UN organization or UNICEF or WHO. So there is a roster that is available. If any of you is interested in joining that, you can subscribe to the roster system. They'll send you reminders. They'll send you notifications. But if you have, that sort of a aspiration to, let's say, join WHO, Geneva, or at Geneva or any other UN organization, do subscribe to those roster systems.
Thank you, sir. Dr. Shrino has asked, what is the future of anesthesia and public health, in rural areas, urban areas, and even tribal areas?
Yeah, so for anesthesia, because it's more like a hospital-based, I would say, like it will happen in these places where you have surgical setups, right? So one role is to is to explore how it can actually improve in hospital care, right? Because if I take an example of maternal health, right, or let's say maternal death, so usually the classification of this entire maternal or maternity event happens in 3 delays, right? Like delay 1, delay 2, delay 3. Delay 1, as they call it, happen in the community, delay 2 in the transport, but delay 3 is actually in the hospital, right? And I believe in order to solve issues within the hospital, and I'm not saying because an anesthetist asked this question, but I must say that a person or a specialist who has complete view of medicine and surgery and basics of care at the hospital is anesthetist, right? So how do we actually utilize their presence, their skill set to solve those delays within the hospital is something that is important. And there, I think specialists like anesthetist can really play a role. The second one is building capacities on basic life support or advanced life support for our community-based cadres, right? So there again, an anesthetist role is an important one, and that goes not only for frontline health workers but general public also, right? Because as we know, there are so many incidences where these basic life support or advanced life support, at least by health workers, can change the outcome of the entire incidents, right? So those two avenues are coming to my mind immediately.
So we also had a very good question during our registration. What are the transformational solutions to help with equitable care for everyone, irrespective of their status or geography?
Transformational solutions, it's a pretty heavy question. But my only take is how do we demystify these complex options that are there in front of us and make it available near to the homes of the client, right? So the biggest transformation that we all can pursue is bringing care near to homes, right? Is my strong opinion, because you may consider peri-urban areas, you may consider rural tribal areas, or you may think of the woman that I showed, on that ambulance in the first slide. The biggest problem is access, right? And access to quality assured care. So how the biggest transformation we all can strive for is bringing care near to their home. And these days, because of gadgets and tech things, self-care is going to get more and more traction, right? So how do we bring best possible care near to homes, or how do we identify or empower clients or patients or family members to take care of their own health and go to nearest places whenever they are at wherever they are at some sort of a risk? And I think this equity and other issues will obviously get addressed if care is made available near to the homes, right?
So there was another question by, I think, an OB/GYN resident. How do I access and contribute to the World Forum in the field of obstetrics and gynecology? Where do I focus? I think this is a question that many people face, when they're in public health or joining public health. Like, what will my domain be? How do I pick it?
What was the first sentence that you used?
How do I access and contribute to the World Forum in the field of obstetrics and gynecology? Where do I focus?
Okay. So see, this is, and I'll be happy to, even share additional linkages on this particular thing, because like I said, I come from the public health obstetrician intersection, right? So most of my work is in women's health. Our organization is dedicated to women's health and family health. So, so there, and we do have OBGYNs who have left their practice and have joined the field, right? Joined the public health field. So if there is a keen interest, we'll be happy to share more subsequently also with the specialist who has asked this question.
Yes.
Yeah.
So I think we can have one last question. Somebody has asked, how can I be a part of Jhpiego?
So you'll be happy to explore all possible options. Like I said, we have our LinkedIn page. We have our we do advertise all our roles on DevNet Jobs India. So please have a look at that, and please also drop a message on my personal LinkedIn account. We'll explore if there are any potential opportunities.
Thank you, sir. Thanks a lot. And before we wrap up, I have one final question for you, sir. So, if you had to redo your journey in public health, what would you have done differently?
So I did specialization in health policy, economics, and finance, right? And I was part of the second batch that actually had that sort of a super specialization within public health, right? But unfortunately, I never got opportunity to practice that health policy and economics. Health policy, yes, but definitely not the economic evaluation, definitely not the financing portion of it. So if I get to go back, I'll really like to, first of all, learn it to its depth, learn it to its actual depth, and then apply those principles in the real world, because all comes down to financing, all comes down to rationalization of available resources. And I think those principles of health economics and outcome research is something that I have not been able to, utilize to its best. Would love to do that if I get the opportunity. And second thing, I would love to, have explored something more around design thinking, because in last, 12, 14 years, what I realized, we've developed so many job aids, so many tools, so many templates, but have given very, very less importance to the principles of design thinking. So the outcome of those job aids and templates would have been much different if I would have been aware about such things. But it's all new knowledge. So yeah, I aspire to learn it more even in future now. Let's see.
Thank you so much for sharing your insights today, sir. I had a wonderful time interacting with you. And on behalf of our audience, I'd like to express a gratitude for your time and perspectives. And thank you for everyone who joined us today. We hope you found this session enriching and that it inspires you to explore public health more deeply. Thank you.
Thank you so much, Dr. Shreyas. Thank you.
Thank you so much.
Thank you so much.